Okay, good afternoon, good morning, depending on where you are. Thank you so much for joining this training session. We are going to get started. We first of all thank you and appreciate you for being here for the first Health Center Program GeoCare Navigator live training. My name is Claire McCormick, and I am a member of the HRSA team that manages this tool. So we're so excited to have some face-to-face time with you today to walk through the functionality of this new tool. We've heard from a lot of you over the past couple of months using the BIPIC contact form, but very excited to have live interaction today. A few housekeeping items. This meeting is being recorded. It will be shared in the future on the Health Center Program GeoCare Navigator resources. So you will be able to revisit this. Users are disabled from coming off mute. We do that just to minimize any distractions. We do have the question and answer feature open though, so please feel free to enter any questions into that Q&A Zoom feature, and we will be able to respond to you directly there. Again, this session is focused primarily on the functionality of the tool, so we ask that you direct any application-specific questions to the BIPIC contact form, where we'd be happy to get you to the right people. And we will have a dedicated question and answer time at the end of the session. So any questions that we don't answer during the live training demo itself, we'll have about 15 or 20 minutes at the end of the session to go through in-depth question and answer. So without further ado, I'm happy to introduce Corinne, who will be walking us through a demo of the tool. And thank you all again so much for being here today.
All right. Thanks, Claire. Hi, everyone. My name is Corinne Ritterhoff, and I will be walking us through our demo of the Health Center Program GeoCare Navigator today. All right, so let's get started. So we are starting at the HRSA Data Warehouse homepage, data.hrsa.gov, where we'll be able to access the Health Center Program GeoCare Navigator, among other tools. So to find the GeoCare Navigator, you'll just need to navigate to the Maps dropdown in the toolbar and select Health Center Program GeoCare Navigator, and this will take us to the mapping application. All right, so now on the screen, when you first come to the GeoCare Navigator, you'll see a map of the United States with a left-hand panel with text related to next steps. This panel can be adjusted to give a larger view of the map at any point. I can kind of pull it over if I want more of the panel to show. I can minimize it a bit, or I can just click it off if I want to just look at the map. For our purposes, we will keep that panel on with a little bit of space as we walk through. So first we'll start off by just going over some of the functionality on this initial page. So the first thing we'll want to take a look at on our header bar is a resources dropdown. So clicking on this resources dropdown, you will see a few different links. So here we have a user guide. So this is going to take us to a link to the user guide PDF. And then we also have an introductory video to kind of guide through this tool. We have a data estimations methodology document. We have a zip code to ZICTA crosswalk, which we'll come back to as we're walking through the tool. And we also have a link back to that HRSA Data Warehouse homepage. So all of this documentation, you may find useful during your usage of the tool. In particular, that zip code to ZICTA crosswalk will probably come in use if you do have zip codes that you'd like to use to create your service area, but you're unsure what zip code tabulation areas those zip codes might translate to. All right, so after exploring the resources, we will go back to our left-hand navigation panel. If you do have a particular application type in mind, whether that is a new access point, service area competition, lookalike, or change in scope, you can use this Get Started button here to select a specific application type. However, you don't need to be filling out an application in order to use the data and the resources that the tool provides. If you do just want to explore the data and the service areas, You can also hit this Get Started button and you'll be able to select any of the following application types we will see. The primary difference between the application type selections is the data that is displayed by default for each type. However, those data selections can be changed during the course of using the tool, so it doesn't necessarily restrict you to that if you just want to explore the data. If you already have a map created and it's been exported into a GeoJSON file format, which is a file format that supports a geographic data structure, you can select Import into Map and you'll be able to directly upload that file for viewing. But in our demo today, we're just going to select the Get Started to create a new service area and sites map. So we'll click on this Get Started to begin our process. So after selecting Get Started, you'll be prompted to select an application type. Again, if you don't have an application type in mind, you can still select any of these options to continue using the tool and getting to that data. So today I'll select the new access point application type, and then I will hit continue. All right, so you can see that once I've selected continue, my map and my left-hand navigation panel both change. So on the navigation panel, I can now see 3 task areas that I'll be able to navigate through different actions while using the tool to support the creation of that application output. I can also see text that appears here now, which indicates all of the map and the data table requirements for a new access point application that I'll need to include. So this text is going to change based on your application type, while the tasks at the top are going to maintain no matter what application type you select. So with the exception of the proposed new sites and the proposed service area ZICTAs, these first 2 bullets here, I will be able to see all of these defaults on the map. So all of the data points here reflect what displays on the map when I first come to this view. And as we'll see, all of these data points here are listed in the data table by default. So the map itself is also now displaying default data points for our new access point application. So I can go to my toolbar and select map layers up here. And I can see all of those different map layers that I have the ability to turn on and off, and which ones are on by default. So in this case, if I open up Health Center program sites, I will see 2 sub-layers here. The first one for Health Center service delivery sites is indicated by this star, which you see populating quite a bit of the map. I'll just zoom in for a little better reference. So you can see that by the open eye, this is a data layer that is turned on, whereas the Health Center administrative only sites is not currently turned on the map. If I do want to display those sites, I can just select that eye icon, and those sites will also update on the map. So those are these green triangles that I just turned on. For our purposes, oh, sorry, it's the blue square that I just turned on. But for our purposes, we will just leave this as the default view. If I do want to select any of the points or any of the ZICTAs on the map for supplemental information, I can do that. So if I want to learn more about a health center service delivery site, I can just select that star and I receive additional information about that particular site. I can do the same with a ZICTA. So if I select the ZICTA, I can now see information related to that ZICTA for both population and health center program specific information for the ZICTA. I can also change my base map when I'm coming to this initial view. So up here we have a base map gallery. Our light gray canvas is our default base map to help with visibility, but I do have other options here. So if I wanted to change to a dark gray canvas, for instance, I can make that adjustment But again, the light gray canvas is what we'll take a look at here, just to allow for kind of optimal visibility into the different layers. All right, so back at the navigation panel, I do have 3 options for creating my map to meet my application requirements. So I can create my service area, I can add service delivery sites, and then ultimately I can review my map and my data table. So there are a couple of ways to go about this. If I want to just jump right in, I can click the start in the top right, and this is going to take me directly to the service area creation. And then I can navigate from that point to the addition of service delivery sites. If at any point during my tasks, I want to go back to this home screen, I can just hit the back button and that will take me there. Another way to go about this, if I don't have a particular order, for instance, if I want to start off with adding my service delivery sites, I can just hit the start under the action panel here and I'll be taken directly to that functionality. In this case, I'm just going to start working through by hitting the start up here, and that will bring me to the creation of my service area. All right, so there are a few different ways to create your service area. So I'm going to look at the Rockville, Maryland area for this demo. And I'll show a few different ways to actually create that service area in the Rockville area. So the first is if I have a relatively small service area, or if I just want to create it by selecting individual ZICTAs on the map, I can use this single selection tool here. So I would just click on this tool to select that option, and then I can directly click on the map and it highlights my ZICTA. So here, the highlighted ZICTA is displayed on the map itself, as well as on the panel. So now I can see all of my ZICTAs that I will be adding in this view right here. So this list will continue to grow as we move forward. If at any point as I'm adding my ZICTAs, I decide that I want to remove one of my ZICTAs or all of them, I do have a couple of options here. If I want to just delete or remove a single ZICTA, I can just use this trash can icon here. If I want to clear all of my ZICTAs that I've selected, I can use this eraser icon. So we'll continue adding to our service area. I can use the line tool if I want to select a few different ZICTAs. So I'll click on the tool, and then I'll be able to use that to kind of draw a line through different ZICTAs. So here I start with a single click on a ZICTA and I continue doing single clicks all the way through. And then when I've reached my final ZICTA that I want to add to that service area, I'll actually do a double click. So that's now added all of the ZICTAs to my service area that had that line cross through them. Again, if I want to delete a single ZICTA, I can just do that here and you'll see it reflected on the map. If I have a particular shape that I want to capture, I can use this polygon tool to do that. So similarly to the line tool, I'll start by selecting it in this list here, and I will start with some single clicks. So I'll click once here. I'll click at every point that I want to drag my tool. And then on my final one, I'll do a double click. And any ZICTA that has kind of fallen within that line that I have created is now captured into my service area selection. Okay. Next up, if I have a particular location in mind, but I'm maybe not sure of the ZICTA, I can use the search tool to find this and add that ZICTA. So here I would just look for a particular location. So if I know I want to have a service area that includes the HRSA headquarters at 5600 Fishers Lane in Rockville, Maryland. I have the results display here. If I want to go to that particular ZICTA, I can select this and you see it's now highlighted here. And if I want to add that to my list of ZICTAs, I just select the plus or the cross here, and that is now added to that list. All right, if I have larger numbers of ZICTAs, or if I'm transposing a list from another place, I have two ways that I can go about doing that. I can upload a CSV file, or I can paste a list of ZICTAs. So we'll start with the upload of a file. So there are a couple of requirements for that file before uploading. The first is that this does need to be a CSV file format. I'll also want to make sure that there is a header for my ZICTA column, and every ZICTA should be listed as a separate row. So we'll take a look at an example file here. So this is just a CSV file that we've put together. So you can see there is a header here, and then each of my ZICTAs has a separate line. So I'm going to close that. So I then go to select file. And here's my ZICTA test file. I open that here. I can see the loading. In this case, it didn't take too long at all to load that information in. And when the file has successfully been uploaded, you'll get a completed note here. And now my ZICTAs are also part of my map. Moving over to the paste functionality, this is the last place to kind of upload or to create your service area, is by pasting a list of ZICTAs. So if you do have a list of ZICTAs that have been separated by commas, you can paste those directly into a text box. So here, so this is just a list of some ZICTAs. So I will copy those from my separate document. I can paste those here. So one thing with the paste of the ZICTAs, you will need to make sure that these are ZICTAs. So if you have zip codes, you'll want to make sure that there is a direct match with a ZICTA. So if you're unsure of what the ZICTA for your zip code might be, you can use this Validate ZICTAs button here. And you'll see that for all of my zip codes that I've added, there is a direct match to a ZICTA here. So it shows you the join type. So there are going to be three different categories here. The first is that the zip code directly matches the ZICTA. The second is if I have a zip code that is one of many zip codes that may make up a ZICTA. In that case, I will have a note that says spatial join. And the third category is if my zip code does not actually match a ZICTA. In that case, you will receive a result of data not found. So here, you'll be able to kind of see the reference for the spatial joins. So you will need to update your input accordingly. So for instance, if 20903 did not actually result in a ZICTA, but there was a spatial join, I would just need to copy the ZICTA, the appropriate ZICTA for this zip code, and add it to this box. If data has not been found, you will probably need to take a look at the zip code to ZICTA crosswalk. So that list is going to show all of the ZICTAs and their corresponding ZICTA and what type of join it has. So that is a good reference tool, especially for this create service area by paste functionality. In this case, all of my zip codes do have a direct match to a ZICTA, so I can add those to my map, and I'll see them display here. So now I do have my complete service area. Another way to go about this is actually looking at it by distance. So all of the functionality here, I was directly adding ZICTAs to my map, whether on the map by clicking or by uploading or searching. But if I have a particular location in mind and want to see some distance information around that to capture service areas, I can do that through the by distance tool. So if I switch over to this tab, you will see that does create a blank canvas for you. So at the moment there are, you basically choose one method to create that service area. So by distance, there are two options here. One is by radius and one is between locations. Selecting by radius allows you to select a point of origin and to adjust the radius from that point. So any ZICTA that is within that radius is going to be captured as part of my service area. You can also use the search tool in the search bar here, which we'll take a look at in just a moment, to search for an address where you might want to place an origin point. So this comes in handy, especially if you want to be very precise with your placement of your point of origin. So here again, I'll just look for the HRSA headquarters. So here you can see it is placing a pin. So this is the location of the HRSA headquarters with that pin placed. One thing to note here, though, is this is not actually showing my, it's not the point of origin. It is just a guiding tool for you to place your point of origin. I do still need to click on this point on the map to place that point of origin. Once I have placed my point of origin, you can see this is a pretty big radius. I just used the default of 30 miles. So it does take a moment to load all of that, but I can adjust this distance by radius however I would like to capture. I can go down to a 1 mile radius. I can go up much higher than that. So here, all of the ZICTAs that have fallen within that radius are captured in my list. If I do want to remove 1 or 2 ZICTAs from that, I can still do that here. You'll see some of the highlighted ones are kind of being removed, but I can't really add anything else outside of that, outside of this area. So I'm never able to kind of expand upon my radius without just adjusting the radius itself. The other way to do this is by using the distance between locations tool. So with the distance between locations, if I have a particular point of origin and a destination in mind, where I want to see maybe what ZICTAs are captured along that route, I can use this functionality. So I can start with my same point of origin. Again, I can use that search tool. I can place my initial point here, and then I can place a destination. So in both cases, for the origin and for the destination, I will just click on the map. I'll get the best route to get there, and I'll get the ZICTAs that cross along that route. So in this case, I'm only selecting 2 ZICTAs along this particular route to create that service area. So this is the by distance functionality. I'll go back to our initial service area creation now, and we'll take a look at the data table now. So as I've been creating this, I can see it visually on the map. I can see my ZICTAs selected on the left-hand panel, but I also have the option to look at the data table. So selecting this caret at the bottom, which maybe it might get a little bit lost, but we do have some helper text here for showing and hiding the panel. If I select that, it opens up my data table. You'll see a couple of things here. So you'll see both a ZICTA table and a selected sites table. We'll take a look at the selected sites table in just a few minutes when we're looking at the addition of new sites. For the ZICTA table, this is where you'll see the defaults for the new application point, new access point application type. So for each ZICTA, we've got the individual records here. These are all of those defaults that you will need to include with your export for that new access point application. So we have the individual Zictor records. We also have a summary record. So down at the very bottom, we have a summary for each of these data points. So this is what you need as your default. However, there are additional data points that you're able to add. So if I want to add some additional data that I'm interested in exploring, if I want to see adults with no flu vaccine, the percentage of the population for these different ZICTAs, I can just select that, and that data point now shows on my data table for all of those ZICTAs. So I can add as many or as few additional data points as I'd like, but the defaults that I need to include here are the ones that are going to be selected as you come to the data table. If I want to do some additional analysis outside of the tool, I can also export my data to CSV file format. So this is going to export anything that I have added to that data table. So I can select that here. And I've now got my data in that CSV format. All right, so now that we've got our service area created, we are going to move on to adding our new proposed sites. So I can just click right here, add service delivery sites, and this takes me to my next area of functionality that I want to work on. So here I'm going to be presented with two different options to add new sites. One by file upload in case I have multiple sites that I want to add at one time, or if I just have a couple of sites and want to add by searching the location, I can add those individually as well. At the top here, this just provides kind of an easy reference to the map layers. So if I click view map layers, it's going to open up these map layers for me to turn on or turn off any of the map layer selections I've got here. I'm going to just stick with my defaults for now, and we'll just focus on adding some new sites. All right, so if I want to add multiple new sites at a time, I can upload a CSV file. Again, I do want to make sure that this is CSV file format, and I want to make sure that I've also included all of the following columns. So I'll want to include the address for the site, the city, the state, the zip code, the site name, and the site type. So once I've uploaded my file, as we'll see, I'm going to be prompted to match the columns. This is really to ensure that any columns with different titles or a different ordering in the file are matched to the appropriate column in the site table, which we'll take a look at as well. All right, so the file we're going to look at is our test file here. So you can see I've got a site name, I've got an address for my site, a city, a state, a zip code, and a site type. So we'll take a look at this information being added. So to do that, I'll just select a file. So here I'll select my site test file. And you can see I'm going to be prompted to add a title for my file. So here, do test for May 7th. And I'll also need to match my fields. So here, you can see the order is slightly different. This is where the matching the fields comes in, is to make sure that in the selected sites table that we'll look at, these are being captured in the right place. So here I want to make sure address is with address, city is with city, state with state, zip code with zip, which I've also titled slightly differently. So I want to make sure that's captured as well. And then site name and site type. So now that I have matched those fields, I can upload my file. And now here you'll see a couple of new locations. So one I've put in Rockville, and then the other is the HHS headquarters in Washington, D.C. So here, both of those sites have been added to my map. I can also take a look at them in the selected sites table. So now all of my information is displaying in that selected sites table. So this is where that mapping really came in, or the matching of the fields. If I have multiple files I want to upload, I can continue to add additional files. But one thing to note is that any updates you need to make in the data itself will need to be done via the file. So if I decide that I want to call my site name something else instead of test site, I will need to make that change in the file itself. I can remove that as my file upload, and then I can re-upload a new version with the corrected data. So just one thing to note here is that editing will need to be done through that file itself rather than on the tool for the file upload. If I have a particular location that I just want to add a single site, or if I just have a couple of sites I want to add, I can do that through my search. So again, we'll just use our example here of the HRSA headquarters. So now I've added that location. I can see it displaying in my site table as well. And here, one thing to note is the site name. So because I searched for this with just the address with no additional information for the tool, the site name is just reflecting as that address. So what I can do is actually edit this name. I just click into the address here, and I can type my updated name here. Select yes, and then my site name has been updated for that. So that is specific to the site that I'm adding by search. Again, for the file upload, I'll need to make those changes in the file itself. And if I wanted to remove this site, I could just hit this trash can icon here and it would remove the site. In this case, I'm going to keep this site on my map as part of my proposed new sites. I can also export this data if I've added a bunch of new sites and I want kind of an easy way to download that to CSV. This is where I would export all of that information. All right, so now we have added our service delivery site, our new site there. We've also created our service area. So I can hit back to take me home. And now I'm going to actually start reviewing my map and my data table. So as I'm reviewing, there are a couple of other things that I can take a look at. If I want to look at ZICTA level data related to population or to UDS reporting indicators, I do have that option. So for individual records, we have all of this data in the data table. But if I want to look at that across the board for all ZICTAs, I have that option by using the population and UDS layers under our toolbar here. So selecting this, I'm presented with this box here, this window, where I can select either population or UDS data. I have quite a few options here. Again, you'll see this reflected in the additional data that is in the data table. In this case, I'm going to turn on the low income percentage. I can add that as a layer. And you'll see my map reflect with different color gradients based on the percentage of low income for that ZICTA. So here, I can zoomed in a little too much. All right, so if I wanted to click on a particular ZICTA, so One way to navigate through the pop-ups where there are multiple layers, I just use this indicator here. So for ZICTA 20906, I have just the general ZICTA information, but I can now also see the information associated with low income. So I can see that percentage, I can see the count, and I can see the population total. So that's by just selecting an individual ZICTA. If I don't really want to look at these layers anymore, I can clear this from the map. One thing to note about this particular functionality, it's all going to be a single selection. You'll only be able to see one layer at a time. If I want to clear the population layer and go to look at UDS data, I can do that as well. Again, quite a few options in here to take a look at. And there are also different variations. So I've got data for awardees, for lookalikes, as well as a combined data set for both awardees and lookalikes. So here I'll look at the combined data set. And again, I can see my map update to reflect the percentages across the different ZICTAs. So now I'm going to clear this again because I don't actually want to export this for our purposes here. And I am ready to export my map and my data table. So one way to do this is by going to Review Map and Data Table, selecting Start. If I want to take a quick look at the data table, I can use this and it will pull up that data table below. And I can also use this to open up our export tool. So this one is going to open up the report option. You can also just click directly onto Print Report up here in the toolbar, and this is going to open up this window as well. So here, I'll need to make some selections. So Map and Legend are turned on by default, but I have a couple of other options. For data table and site information, I can turn either of those on. I will need to make sure that I have data for both of those in order to be able to make this selection. So if I have not selected any ZICTAs to create my service area, I'm not going to have the option to add a data table to my export because there's no data to capture there. Same goes for site information. If I haven't added any new sites, I'm not going to have the option for selecting site information. If I do want to add some kind of additional note, if I have some supplemental information I want to include, I could select this to kind of put in a text box with that additional information. I can also give my report a name. And then I can select my file format. So this is where if I wanted to create a GeoJSON file, I could select that. It would capture all of the geographic information that I have collected. But in this case, I want to just go with a PDF option. And I'm going to hit export. For larger selections, it may take a moment to download. And that's where the zoom also, I'll want to be at kind of the right zoom level where basically anything that is kind of in my view, I'll want to capture that. So here my report has downloaded. And I can see my map with all of my selected ZICTAs, my new site, and the view that I was in. I'll have a legend right here to show what some of these icons mean. I've got my data table with all of those defaults and the individual ZICTA level data, as well as the summary data. And then I've also got my site information that I added. All right, so this is kind of the final output for our map. One thing I do want to call out before we really wrap up and move into our Q&A section is if you are experiencing any issues with anything, a first kind of rule of thumb that comes in handy is to clear your browser cache. So that's a good first step. If you are seeing an issue persist after clearing your cache, please definitely let us know through that BIPIC contact center form that we'll also take a look at. All right, so that wraps up our demo for the Health Center Program GeoCare Navigator for today. So next we're going to move into our Q&A session, and then at the very end we will take a look at that BIPIC contact form as well on our last slide.
Thank you so much, Corinne. Can you hear me?
Yes, I can hear you.
Hi, thank you so much. So we've gotten a lot of good questions that we've been answering throughout the demo. And so at this point, Christina Mertz, who is another member of our team, and I are going to begin answering some questions out loud. Again, we totally recommend you utilize the Q&A feature. If we do not get to your question during this question and answer portion of the session, please reach out to us via the BIPIC contact form. I'm putting the link in the chat now. At the very end of this training, we'll go over the section that you can find us under, but we are there and ready to help or direct you to the right place for help if we're not able to answer your question today. So Christina, our first question is, our health center is submitting a change in scope to add a new site, and this would apply for any type of application. The EHB form asks about documents from UDS Mapper. Should we plan to submit GeoCare Navigator maps instead?
Yes, thank you so much, Claire, and thank you for the question. This question came in anonymously, but I was hoping someone would ask about this. We are working to update the EHB module to change all the language from UDS Mapper to the new tool. So in the coming weeks, you'll see that we have changed all of the directions into the GeoCare Navigator. So yes, for now, while it says UDS Mapper, just know we're working on changing those links. If you use the link in the EHB module, it will take you to the GeoCare Navigator. We do have that direct link set up. So yes, please use the GeoCare Navigator for anywhere in the EHB form where it asks you to reference it. So thank you again for that question.
The next question is, what are the differences in the types of data depending on the type of application chosen?
Yeah, that's a really great question. And Corinne, I'm wondering if we could maybe take a look at the different application types on that homepage. So we have the 4 different application types. They're subtly different. We worked with the subject matter experts for each of the application types to kind of get an idea of what each of our reviewers wants to see when they are reviewing these applications. So there's a lot of overlap between all 4 of these. All 4 of them you will see. I think hospitals is a common one that we see on the map, service delivery sites for both health centers and lookalikes. And then there are very, very subtle changes. But if you ever wanted to add anything to either one of these 4, you could through the map layers widget or into the data table. So you're able to add any layer that you want to any of the application types. But again, these defaults that we've set up, these are the defaults that our application reviewers kind of chose. So we wouldn't suggest kind of changing them too much, but you'll be able to get to all the different map layers as well as all the additional data table elements by going through any of the applications. So hopefully that helps. And then I'm wondering, Corinne, if we could go into maybe service area competition. And we actually do in the text box here, you'll see under the 3 tasks, we list what's defaulted on the map. So you'll be able to crosswalk that top section shows what's in the map layers. And then the second section of bullets is what is in the data table. And so when you read those, you'll be able to match them to what is showing up automatically on the map and data table. You don't really have to do anything extra to get those. We already kind of defaulted them for you. So yeah, just subtle changes between each of the application types based on what our reviewers wanted to see.
Excellent. And Corinne, while you have this up, Christina, another question is, what is the best option to use to get general data when you need to show demographics within specific ZICDAs but are not doing a formal application? And we got some other questions along the lines of, what if we just want to use the map for other purposes? Are there any options to make maps without having to select a default map type?
Yeah, that's a really good question. We know that people are kind of in here just poking around. Maybe you're not ready to submit a formal application. You can really use any of the application types, and then you can go kind of searching for the other data elements Corinne has up, like the little pop out that gives you all of the different options. There's over 100 data points in this that are available in this data table. So for the application specific requests, we've limited those to like 5 to 10 elements. But if you're just exploring, feel free to use any of the application types and then come in here and select, those extra elements that you would want to see.
Wonderful. Can you please show how we can tell the number of health center program patients in each ZICTA and the HCP grantees serving each ZICTA, as well as the percentage of patients served?
Yes, perfect. Yeah, I wanted to, this is kind of a more technical question that I wanted to answer. So I'm wondering if, Corinne, we could maybe select a service area, like a couple of ZICTAs, and then go into the data table and I can walk us through answering this. Perfect. Thank you. Yeah, so Corinne's going to just select a few ZICTAs here. You'll notice that the data table doesn't actually populate unless we have a service area selected. So now she's popped up the data table and I'm just looking back at the question. It looks like, okay, number of health center program patients. So in the data table, you'll see for our 3 ZICTAs, Corinne is highlighting it with her cursor, the 38, 110, 82, and then the summary row of 230. And so that's where you'll get the patients and then the health center program grantees. So that's a really good question too. That is going to be in the Dominant Health Center 2022 data. You'll see that Neighborhood Health is the one that is the top serving health center. They serve the most patients. And then Corinne, I'm wondering if we could in the other data elements, like we need a few more that I wanted to show folks. So if we could pop that out and try to find the Dominant Health Center share of patients, I think it's towards the bottom. Perfect. Yeah, so here's the #1 Dominant Health Center share of patients. And so that's going to pair with the Dominant Health Center, Neighborhood Health in this area. And then in the data table as well, we have up to 5, the first 5 Dominant Health Centers. We are able to show that similar to how UDS Mapper has that. And so you'll find that towards the bottom. Corinne is kind of showing where each of those 5 are. So feel free to take a look at those. None of them are defaulted just because it does turn out to be, a lot of columns, but feel free to use that to search for those, the dominant health centers in the area.
Thanks so much, Christina. Just a reminder that a recording of this presentation will be available in the coming weeks. We will be sharing that under the resources tab. So the resources is where you can find that really helpful user guide, as well as an introductory video, soon the recording of this live training. And there's also a zip to ZICTA crosswalk. Corinne, I don't know if you could just open that. We've gotten a couple questions about that. This is where if you're not quite sure what your zip code is in a ZICTA, this is where you can check that. So just want to highlight that feature.
Yes, perfect. And then Claire, I just saw another question pop up that I wanted to answer while we were in the tool and in that data table. We got a question on how do you pull up the ZICTA level pop-up table? So that's a really good question. There are 2 ways to do that. So you can either pop it up with the little down arrow that's above the data table. It's like under the map view. Yeah, perfect. So Corinne is just showing us down at the bottom. I know it's a little small, but that's how you would pop up the data table. You can also get to the data table by going to, and Corinne knows exactly what I'm talking about. Yeah, perfect. So within the task list, there's a task called Review Map and Data Table. And you'll see when you click into that, there's the black button there that says View Data Table, and that will pop up the table as well. So just a few different options for popping up the data table. So just wanted to go over that. And then I'm just scrolling through the questions, and sorry if we don't get to them all during this time. Feel free to send us that BIPIC contact form ticket. But we have someone who's asking about when will the data be updated? So we're hoping for a late summer, early fall update of all of the data. So I think that's a similar schedule to UDS Mapper. So yeah, expect that in the coming months. I'm scrolling through. Is there a way to search by service type, for example, mental health service and substance use disorder treatment? So we actually don't have that in the tool right now. If there's anything that you guys really could use in this tool, like we are taking we're taking notes and we're taking down lists of enhancements. So I think a few of you have asked questions where it's something, a function that we don't have in the tool yet. Feel free to send us a BIPIC contact form ticket just so that we can start logging those, because we're going to start, prioritizing those and trying to get you guys what you're interested in having in terms of added functionality. So if we don't get to your question or suggestion today, just feel free to reach out to us through the contact form.
Hi, Christina. Lots of questions about drawing on the map or labeling sites.
Yes. Okay, perfect. No, I wanted to get to that as well. So we don't have an option right now to label sites on the map currently. It's something that we have been thinking about. We've been hearing from you guys. We're definitely wanting to prioritize that. So there is no option to label right now. If you wanted to get a list of sites that are in a specific zip code and you just need the list for your own benefit, or, you want to send a list of, all the sites, you can actually go to our data downloads page. It's on hrsa.data.gov. And I have it up. So let me put that in the chat. And if you go here and then go to our service delivery and lookalike sites, you're able to actually get that list. So let me send that along. Get the list of service sites. And I'll send that link along. Okay, just looking through. Are any prior year data available? So no, we don't have any prior year data. I know it sounds like you want to do some trend analysis. This is all going to be the most up-to-date data that we have. So data from the 2022 UDS and then population data, the most recent. And then we'll be doing updates, like I said, later this year.
There's a question about, is there a way to adjust the map size on the download? We've seen a lot of that as well.
Oh, the map size. Okay. So
I think we can show them the zooming in and zooming out.
Oh, sure. Yeah. Corinne, do you mind showing just kind of like a zoomed out version and then maybe a zoomed in?
Sure, yeah, and I think this is for the export.
Yes, yes. Perfect. Yeah. So this is kind of that more zoomed out view where you don't see a ton of the detail of the symbology. And then, yeah, and it's reflecting exactly what's in what was the zoom level when Corinne was in the tool. And then you'd be able to kind of zoom in more to get a more detailed view, I guess, especially in the DC area, you'll see a lot of symbols going on. But yeah, you can adjust the zoom level and then do a reprint, and that will help with the level of detail that you can see. Perfect. And while Corinne is doing that, I'm just scrolling through the chat. Yeah, so this is definitely a more zoomed in look where you can see kind of, a more focused print export. And then, okay, I think someone kind of clarified their question. Maybe I think I misread it. So, Corinne, could we actually click on one of the symbols? Like maybe one of the symbols that's in one of the shaded regions for like medically underserved. In the information pop-up, I think we want to show how we can like scroll to see the service delivery site, then the ZICTA, and then the MUA in the actual like information card pop-up. Perfect. Yeah, like maybe a service delivery site in one of the pink areas. Perfect. Yeah, so this is the information card, and this is where Corinne is showing there's kind of wherever you click in the map, there's going to be this information card pop up that'll give you information about the ZICTA. It'll give you information about whatever boundary is turned on. So right now we have underserved that boundary turned on. We have a service delivery site, so it's giving that data. And you'll see at the bottom right of the information card, it says 2 of 3. So that's where it's showing you how many different information cards would be available, and you can kind of scroll through them. So hopefully that helps with that question. Okay.
I think we have time for one or two more. A good question that I saw is if you add a data element to the data table, can you easily remove it by unclicking the option for that data? So if you add something, for instance, Corinne just added population age adjusted mortality percentage, you can just unclick it and it'll come right out of that data table.
And then we do, since we're in the data table, we did get a question. We got a few questions about the summary row. And I know in UDS Mapper, it was above the data set, like above the ZICTAs, but in this tool, we've put it at the bottom. So you'll see that summary row is actually at the bottom of the data table. So hopefully that helps everyone. And yeah, like Corinne she just kind of resized the data table by kind of waiting, like hovering her cursor over the break between the map view and the data table. So, and just moving it up and down. So that allows you to get a little bit more room. You know, once you have more than a few ZICTAs, you might just have to either readjust or scroll down in that data table to see the summary. So hopefully that helps.
I think we are running up on time. And so at this point, I want to thank everyone so much for joining us. Thank you to Corinne for giving us a wonderful demo and to Christina for answering questions. We really appreciate your time today. If we did not get to your question and you'd still like to reach out, or if you ever run into any problems, please get in contact with us via the BIPIC contact form. You can find us under Health Center Data and Research. And then we've got our own category, Health Center, GeoCare Navigator, formerly UDS Mapper. We're really on top of those and try to get back to you quickly. So please feel free to reach out to us there. And we really appreciate everyone's time and hope everyone has a great rest of their week. Thanks so much.